Well, hello and welcome to the Coaching Center podcast, where we empower individuals by sharing stories of entrepreneurs and powerful people with powerful stories. And today we have the great pleasure of having Dr. Maria Lang. Hello.
Thank you. Thank you for the introduction. I'm glad to be here.
Yes, I'm glad you're here. So start off by telling us about your organization.
Here in health and wellness, and I've been in the medical field for 30 years now, and I'm still learning.
Yeah, I love that. I love that.
And I am an alternative and holistic physician, which means I treat the body as a whole, body, mind, and spirit, and emotions. I also do functional medicine, that's part of it. Again, treating the body as a whole instead of an individual symptom. And so we treat root causes of all diseases.
Awesome. So why? Why did you get into this profession?
As I told many of people, I accidentally got into it. It found me. I didn't find it.
That's usually how it happens.
Yes. It started way back with my pain when I was a child. I grew up with back problems, almost paralyzed from the waist down twice in my life. And I was given a corselet, which is a brace from the waist down. And I do have juvenile rheumatoid arthritis, which is a joint disease, and Addison's, which is an adrenal insufficiency with the endocrine system. But getting back to my pain, where it started me off, and my initial journey was when I was 17 and sat down with that physician with my sister, and he said, for the rest of your life, you are going to be limited in a lifestyle. And no kid, you will not be able to have a kid, you will not be able to be active, you will not be able to run and do a lot of sports.
Early on, they told you all this early on in your life?
Yes. And I've told this many of times in the last 30 years, different things, and I have proved them wrong.
That's right.
And that's exactly why I'm here today, to share my stories. So I embraced myself into holistic health care from that point onwards. I then, at a young age, started massage school, and then I started got my way into doctor's offices for about a decade, and I started just doing all my schooling, became a medical assistant and just little rehab tech working for surgery centers. And so I found people to help me out. I mean, I used to get up in the morning when I was young, and I'd have to crawl with my forearms or roll myself in the bathtub. Okay, so just to tell you where I was at. So we can do it. It's who's going to tell you that you can do something or give you the tools. So I promise you, if you work hard at it and you believe in yourself and you stay away from those naysayers, you can do it, because it's all in here. I promise you. Yes. So that's how I started my journey in my pain management practice. And started treating patients with acupuncture. I'm an acupuncture physician as well, a doctor of Oriental medicine. I went over China. When I came back in 2000 from my internship, that's where I got my master's of Oriental medicine, and that's when I started my holistic skincare, my practice. I do my own proprietary blend of a holistic skincare, doing microneedling,
Nice.
hair restoration, and whatnot. So,
I might need hair restoration.
I've told you, you're a long-term patient until I retire. A long-term patient.
Wow. So
it's fun.
it sounds like you turned your pain, or you turned your barrier into a strength.
Yep, like I say, I turned my pain into my purpose. It took me a while to figure it out. I was fighting it, and even when I came back into the States in 2000, and I opened up my private practice, and it's in Lake Mary, Florida. When I opened up my private practice, I came back with mercury poisoning.
Oh, jeez.
So, yes, just to top it off. And then I went into the conventional world, which, as I was telling you last time, I took the blue pill, or you want to take the red pill. And the blue pill is conventional medicine, where they treat with symptoms usually. and symptoms and diagnose. And then the red pill is you're going to keep on looking for a better path, doing holistic medicine, alternative, finding the root cause of the disease. And have I, like many other people in this world, have I done the blue pill? Absolutely, yes.
But can they both be done together?
They can.
Can they live in the same world?
Absolutely, absolutely. But my goal was, which I did, was get off that blue pill or that lifestyle and get into the red pill where I'm happier and healthier because there's side effects from the other one. And then I underwent chelation, radiation therapy to get rid of that mercury poisoning. Of course, when you have mercury poisoning, there's just a lot of setbacks altogether. I mean, there's just a dozen on the list there. So it was a big journey. Did I have physicians tell me conventional? And first of all, let me just explain the difference between conventional medicine and functional medicine. I believe that both worlds help. As I stated on my website back in 2000, when East meets West, this would be a beautiful world. But Eastern medicine is your functional medicine doctors. They could be a acupuncturist. They could be they could be a medical doctor, DO. Okay. And then you have your conventional, or another name is standard medicine, okay? So standard medicine, they treat the individual part and by the symptoms. And usually it's give them a pill, right? And then if you would see a holistic alternative physician, functional medicine, they would treat you by the whole body they would look at.
Okay, so it is possible. Using both of them in the same, it works, right? It's like a holistic approach.
Does work. I mean, for instance, let me just give you last case on Thursday when I was seeing patients, blood pressure. I was seeing a functional medicine patient for about 3 months. They spoke to their conventional doctor and they were weaning them off the blood pressure medication. But my thoughts are you always going to be on this statin? When I first saw them, well, that's what he was educated on. So here we are as a functional medicine doctors, we educate you. And that's the toughest thing right now is because, we just need trillions and trillions of lifestyle, health coaches, functional medicine doctors. It's just the knowledge that the patients do not have right now.
It's not easy to get as most people think it is. It's really hard to get a hold of that knowledge because we don't know where to look.
They're and not to be disrespectful, they're uneducated. So this patient did not know there was nutritional deficiencies. He was under the understanding, I'm always going to be on this blood pressure medication. So that's when we step in as functional medicine physicians or holistic physicians and say, okay, these are your steps. Okay. Yes, you started exercise routine. You don't go out and run a marathon, but just start walking, you're good. But just, drinking more water, 8 glasses of water a day is going to make a difference. Sleeping is going to make a difference in anyone's lifestyle because when you sleep, you boost your immune system. You increase your T cells, which are your white blood cells, which are going to help you.
Hear that? Go to sleep. Everybody just go to sleep. Don't go to work. Just go to sleep all day. I love this. You are my doc. That's what I was looking for. I needed somebody to tell me, go to sleep all day. You'll be better. Yes.
So just know that you could reach those goals and just encourage them because they're on this other side where they're getting discouraged. Yes, conventional medicine is very good for emergency situations. I just saw that 72 hours ago with one of my nursing home patients, and she comes in beautiful, but holistic medicine, and there was an emergency situation. I jumped in and helped them out, but yes, it'd be perfect world. It would be a perfect world if we could just work together.
Oh, nice. Well, I like that. So you said the education part. So how do we change that? Because the world I come from, educational health was not a thing. So how do we change that in our communities and in communities where they don't get enough of that education? How do we make that more available?
Unlimited access healthcare.
Oh.
Is what I call it. Yes.
Okay. Yes. Tell me more.
So, per your zip code, you're going to find, if you're sick, you're going to get certain care. It's a fact. I'm sorry. It's a fact.
Yeah, I know. I definitely know what you're talking about.
You've shared a couple stories with me, and when you go see the physician, you look up to the physician. It starts right there when you walk in their door. And it's the type of physicians that you do have, but then it goes to, if he or she sends you out for laboratory testing, it goes to the facilities nearby in that zip code who have, like some people who would have, let's say, cancer, and they will go to another state nowadays, right? They will find the best of care in the family. Shoot, they'll take them by the jet if they can, okay? So her zip code, okay, you got a jet, they're going to take you right there. But let's just talk about the people who don't even have the money for a can of tuna.
Yeah.
Okay.
Well, I have a story for you because you told me this before, and something happened to me this week that proves your point completely. You know I was supposed to get a procedure.
Yes.
I didn't get it. So listen to what just happened. So I was supposed to have a procedure in a clinic, right? I knew the price, what I had to pay with my deductible. Everything was set out. It was $1,700. But at the last minute, the night before, they moved it to another hospital in another zip code. The price went up to $4,800 overnight because now it's in this other zip code. Yeah. And of course, I got upset. How can I mean, I didn't change it. You did, you know? Right. So that proves your point that it really does depend where you are, where you're from, and where you are. Look, my health now I have to wait because I refuse to pay more just because they moved me from one building to another. That's not my problem. I don't want to move. I was fine where we were. And they told me it's because of the bells and whistles. Yep. But I don't want bells and whistles. I just want you to use the knife, cut, and get it over with. So it proves your point, exactly what you're saying. So that's pretty cool. So let me ask you this. What's the best thing about your work?
Best thing about my work is seeing the end results and during the process, the emotion. And that's why I said initially my statement, functional medicine holistic, is we body, mind, spirit, and the emotions.
It's a whole package.
Oh, yes. You know, if you ask me what someone could do today just to start their health off to better, not only drink water, okay? And I'm not going to say exercise, God forbid. Maybe you could stretch. Maybe you could stretch just a little bit, but it's amazing how yoga and meditation, mindfulness is very, very powerful. But just to see them through that emotional process, and then you have to guide them and lead it, and just give them these simple little tools that no one would even think of. Like this girl was depressed yesterday with anxiety. She says, I used to always do this, and it's exactly what's on the list, body, mind, and spirit. You know, and it's really nice to see them during the process, because initially when they come in, they think, okay, I got this, thinking that I could get to A and B. Okay, all right. That's cool.
But that's what they're used to, right?
They accept it, even with the zip code stuff, okay? They accept it. But also another thing is, not only that, but when you get them to C, D, and let's even talk Z, when you get them to their path, I have to tell them, and they're tearing up emotionally in the sense where they're happy, overwhelmed with joy, did not know. They're better than what they used to be before. And that's what happened to me a lot when I first started my pain management clinic. They would come from the emergency room or all over and like, oh, you can't do much. You know, my arm only lifts to here. And
they're used to that type of service.
They couldn't get their arm up the wall or whatever the condition, or I could only move my neck or my back. I could never do this. I could never get out of my car, right? I had to stop driving. Now I can drive. That was one of my other cases of workman's comp. Now I can drive, and I couldn't do that before. But just to see them when they've reached that point and they never thought they would be there, it just... the life in them, their eyes, just the sparkle in their eyes, they're much better.
Now, something else, like you've had all this background, these barriers with your health. Talk about your marathons and all that stuff, like, because you told me so much. No, first say what you've done.
I'm telling you, if you look it up, it's really, I mean, you can do it. You can do it. Don't stop. Set your mind. I mean, there's just tools, yes, you got to use. Write it down like I told you last time. I use my bathroom mirror. I just write down 2 things. I stick to 2 things. So, I mean, I used to do the list of 100 things I want to do, but that doesn't work. It's too overwhelming. You know, just 2 things you're going to focus on, what you're going to do. Go back to it in a month, and how did you do? And that's what I had to do. I did, yes. For 20 years, since 2000, it's been my journey to take patients through my journey. If they were sick, I grabbed them, Dr. Cab. I grabbed them.
You're a healer. You're a healer.
I grabbed them. So I would take them out for 5Ks, 10Ks, and, we'll walk the 5K. Okay. Well, then, I'd convince them to do even half marathons. And I share with everyone my friend who had breast cancer, a survivor, and she, sure enough, she ended up doing a full marathon, long story short, but it was a journey, but she took baby steps in those couple of years. Some people can't look that far, okay? But if you can't look that far, that's okay. Just look up for a couple months, because when I signed up for my half Ironman, I just signed up. I didn't know what I was getting into. It's like, okay, now I realize, okay, you better eat better, you better sleep better, you just better follow the program.
So baby steps. So okay, so if you had people listening now, what would you tell them to start with? What is something they could do right now, small, really small, to start going towards their health?
Yes. Get up every morning. Get your butt out of bed, get your shoes ready the night before, and your socks, and the bottle of water, and just go walk a mile every morning.
A mile every morning.
Everyone
can do that. Anyone can do that.
And get rid of the cell phone too.
No, but you had a point. You've talked to me about it before, that people are always in their cell phone. How can that be used as?
Oh, it was great, because on my way over here, I was talking to a guy. He goes, "I'm not good at English," and I said, "Rephrase that for me, would you?" So I said, "Look at me." I said, "Don't look in the rearview mirror. Let's talk about where you're going." Okay. He goes, "I can." Yes. And then and that's why I was asking you, is it Surrey or Siri? And I said, Siri.
No, you said Surrey.
And all you have, look, when we were younger, we have to pull out the books, okay? Right now, I don't even know if they're going to have books for school anymore, okay? But all you have to do is ask your phone for, how do I start a good day? It might say, do yoga, drink water, go for a walk. And I know that everybody's got at least one or two cell phones right at their hip, right? You got a college dictionary right at you. You can look it up. Let's just say, how to decrease my blood pressure. They got basic things. Okay, first see your doctor, okay? But they have basic things there. It would probably say, go for a walk every morning, drink more water, stay away from so much alcohol during the holidays, cut your carbs during the holidays, get off the sweets. It's going to affect your diabetes. What are we faced in this world? An epidemic of what? Cancer, diabetes, cardiovascular disease. We haven't hit depression yet, but why do we have depression? Maybe because of the underlining root causes of all the other elements I just spoke about. So it's right after you have the information. If you take just a couple minutes a day, every single day of the week, let's just say you don't have to take the time you take texting, because I know those young ones, you're great people. But I know you text a lot and you're so quick. I don't even know how the heck you do it, okay? Because, I told you, I got rid of my TV, the whole cell phone thing too. But the time that you take texting, you could just go onto Google College, right? That's what we call it now. And you can get gobs of information about your health. There's free apps, I was saying, right? There's just free apps.
Many that we can tell someone.
Nike has a free app that you can use. I forget what it's called, but Nike does have a free app. There's a fitness coach. Yes, I think there's a small fee that you have to pay for, but there's so many apps. On my way over here, when I was trying to help this kid, I just said, Siri, what are apps you could use for learning English better? She just came up. Mine's a he, okay? Mine's a he. He just came. I like his voice, I like his voice, okay? But he came up with 6 different things, and this kid, he's a millennial kid, right? He just like, wow. And then I said, you want to know another thing? Because he wanted to get into exercise, and I just said, Siri, what could I do? And I showed it to him. I'm just reaching over the front seat while he's driving, but I had to get my few minutes with this kid and help him out.
So yeah, that's actually good. You have to. That's a healer. So so you're saying spend a few minutes to just look up what you want to know, and it's there. And yeah, we're doing it all the time. So why not do it about your health?
Information's there.
How about food?
Food.
Talk a little bit about food.
Well, we don't have 8 hours. We wanted to keep this a little shorter today. Food. Well, good questions. What could I do to eat healthier? Well, first of all, I think a good thing I've been doing with a lot of people is doing a 10-day detox, or even if you have a lot of health conditions, you're seeing your physician quite a bit, would be, doing a 72-hour sugar detox. Sugar detox. What does it mean? No sugar, decrease the carbs, get off the cheese, right? And the milk. It's not going to hurt you for 72 hours. Even if you did it for 10 days, you're going to notice phenomenal changes. Not only are you going to sleep better, the inflammation in your face, the legs, increased blood circulation. You're going to be in a better mood because all that sugar. I mean, look how many tablespoons a day. What is it? 22 tablespoons a day we take in a sugar. The average person and the younger kids, they say, taking in about 30 plus. I mean, that's a lot of sugar to take in a day times 365 days. That's
So a 72-hour detox of sugar. What would you say replace it with?
What I'm into, I love avocados are good for you. It's a great oil.
Yes.
Okay, so some good potassium. Put a little salt and pepper on there. I do have that. Yes. And then I'm into only organic. The U.S. lags behind from the other countries doing GMO-free, meaning no chemicals in the food, and it is very dangerous with all these chemicals. But
talk about that. You've talked about that a lot with me, about the food, how...
Well, the food chain has changed. It's different from 20 years ago, or when I was, in the 80s, I could go in the garden and just pick out a cherry from sitting on the ground and just eat it, and you don't have to worry about the dirt having any pesticides or anything. I mean, look, why are farmers in these, I call them spacesuits, in these spacesuits covered, their head, their hands covered to spray all of these wonderful crops that are going into these beautiful grocery stores, our favorite grocery store that feeds your wife, your children, the grandkids. And then we're told that you could buy this $8 cleaner, so upsell, right? I call it. You can buy this nice cleaner, buy all the vegetables and fruits that will take off that chemical. Really? Because I met one of those guys and I asked him, I said, well, why don't you just take off the gloves? No big deal. Or just the space. He goes, oh, no. I mean, it was his accent. Okay. No. I go, what's the big deal? You got to spray. We'll just spray your face and spray your hands. No. He says, I would never eat that stuff. So, we lag behind. I find your vendor, I call it. I have my butcher I go to, and my butcher sells the fruits and vegetables. Do they die in just a couple days if you don't preserve them in that Ziploc, container, maybe a little towel? Yes, they do. That's because they don't have all the preservatives in them. So, you were asking me about my diet here. I just keep it really simple. I like to have lamb, chicken. I have grass-fed beef once in a while, not too often. I like my wild-caught fish, my salmon. I love my morning sardines. I can't help it. I grew up that way, so 10 o'clock in the morning, you all better hold your nose. Okay, my vegetables, garlic is a natural antibiotic. Ginger, before I came over here, I made my little concoction. I love this. It's mint, lemon, and ginger. I put it in a blender and I put it on extract and I drink that for the week, just a couple tablespoons of it with water. It helps with your GI system, helps boost your immune system. So these are just natural little tips that we could do for mindfulness.
Nice. I like it. So tell me.
Oh, my vegetables. I do eat vegetables. Yeah, my vegetables. Got to get those in. Okay, my fruits are only just the berry family. I have a very low sugar intake that I take because of my hypoglycemia. But I like the broccoli's very clean, asparagus, your greens, pretty much your greens I eat.
Nice. I love it. So where are you from? Actually, because you said some of the stuff we're talking about growing up, like sardines, where are you from?
I am first generation American and proud of it.
Yes.
I was born in Cleveland, Ohio, and then I moved to a small town called Marion, Ohio, on a farm of 120 acres. And
so you're a farm girl.
Yes. So lots of fruits and vegetables there, and we jump on the horses to, pick the apples for our apple pie. I jump on the horse. No saddle.
I'm gonna say no, thank you. I don't know why horses. You're not supposed to get on horses. They're beasts.
We can talk about pigs too.
Pigs? What do you get on pigs?
No, I didn't get on pigs. I would just give them stuff that would just go bad. Just in the.
Yeah. So you fed pigs.
Yeah, when the beer got old or something, you never waste things, right?
Wait, what?
My parents are from Europe, so when they moved to America, they always had us, in the kitchen and everything. And so we had our homemade wine and then our homemade beer.
You would give pigs beer?
Yeah, it went bad. I was just a little kid. I didn't know better, but the veterinarian was there the next day, and I didn't know. I told the story about 20 years later. What happened with that? And I was like...
Did they get drunk? Did they act?
Only the little pig liked all the beer.
Give it to the little pigs too?
To all the pigs.
Oh my God, there's crimes against that, isn't there?
Well, I was raised
Keep your pigs away from Maria.
My parents came from Europe and during the hard times in the early 40s, and my mom lived in a lot of refugee camps, and I learned you do not waste things. Okay, so I still wash out my Ziploc bags.
Oh my God! So an entrepreneur, huh? So you love being an entrepreneur. We talk about that a lot.
I love being an entrepreneur. Yes. When my parents came over here, they did open up a business, tool and die makers. So I was always, helping out, working. You always had to work.
Oh, so that's what you're used to.
Yes, I'm used to that, being a hard worker, and I always watched my family and, my grandma who came overseas, and she was always such a hard worker. And so the work ethic was really hard. And when you do a job, you do it right. You just don't do a half job. So it's just, I'm really into it.
So you love being an entrepreneur. So, so let's talk about that a little bit. What would you tell someone that is opening a business for the first time? What advice would you give them about being an entrepreneur? What should they expect?
Well, I'll tell you the advice I have told young entrepreneurs. First of all, congratulate them.
Yes.
Yeah. It's a big step. It's a big step for success. And not only will I tell them they need to sleep and drink water.
Here we go again.
Never tell them to exercise. Don't do that stuff. But I would also tell them that they need to find at least two, the more the merrier, entrepreneurs who've been out there for 10 to 20 years. And they need to get together with them. I always did this. Get together with them every couple weeks, if they can, and just, coffee.
And collaborate. Yeah, it's very important to collaborate with other. It could be lonely, right, to be an entrepreneur at times. So building a community around you will definitely, and it gets hard. Being an entrepreneur can be really hard sometimes.
You're going to have tough points. You need to bounce things back on somebody else, even if it's another business. I mean, having a medical practice for 20 years, you're going to have your challenges. You're going to have maybe the county or state comes in one day and say, okay, this license, there's a little typo, an error, something like that.
Happens all the time.
Yeah, and then at the same time, you're going to have